I'd like to take a few minutes of your time to let you know about something that may be as important to your health as it has been to mine. A few years ago, while jogging at Camp David, I found out that I had an irregular heartbeat called atrial fibrillation. I noticed the symptoms in time, and fortunately, my doctors were able to treat me. I feel very lucky because atrial fibrillation is one of the conditions that can lead to a stroke, the major cause of disability in adults.
Atrial fibrillation is the most common heart rhythm problem in the world. Several million people in the United States are afflicted with this condition.
I've been an athlete for 21 years, and I actually do have atrial fibrillation. It's a hard thing to admit to yourself, thinking you have one of the strongest hearts around, and that you're maybe invincible in that way. There are days when I plan to go out and work out, and I cannot work out at least the same effort, or I can feel very tired.
When I would exercise, I would become tired, sweating, then I start going into a heart racing real fast. I couldn't slow it down.
It was that pounding in my chest that wouldn't go away, and it didn't go away.
As one gets older, you are more likely to get atrial fibrillation. So although atrial fibrillation can occur in childhood, teenage years, or in young adults, there is a higher risk of this when one reaches middle age, and especially when one is over 60 years old.
To understand atrial fibrillation, we need to take a look at the two upper chambers of the heart. These are called the atria. Usually they contract forcefully and regularly to move blood through the heart. Sometimes these upper chambers quiver instead of contracting strongly. This means that blood isn't pumped completely out of the upper chambers. As a result, the blood that should move through the heart can pool and form clots. If a blood clot travels out of the heart and gets stuck in the circulation of the brain, the person develops a stroke. Approximately 75,000 strokes occur each year in the United States because of atrial fibrillation.
Well, atrial fibrillation is one of the most common causes of stroke. Really, if there are 500,000 strokes in the United States every year, about a third in older people is caused by atrial fibrillation.
The symptoms of atrial fibrillation include loss of energy, irregular pulse or heartbeat, dizziness, shortness of breath, chest pain or unusual discomfort, including feelings of pressure. Sometimes these symptoms may not be very obvious.
In the beginning, people don't really know they have it. They'll notice occasional skipped beats or flutterings in the chest. Some of them will notice that they're a little bit dizzy off and on.
I think acknowledging that you might have a heart problem is the best thing you can do, and go get it checked out.
If you visit your doctor or clinic to check out any of the symptoms of atrial fibrillation, you can expect to have an electrocardiogram, or ECG. This is simply a recording of your heart rhythm on a strip of paper and shows your doctor if you are having atrial fibrillation at the time of your visit. This test is often followed by a 24-hour recording of your heart rhythm to see when and if you are having atrial fibrillation. Other tests may follow to check your heart's function.
There are many heart conditions that are associated with the development of atrial fibrillation. When one has the diagnosis of atrial fibrillation, these heart conditions have to be excluded as maybe being the cause of this atrial fibrillation. The most common of this is long-standing high blood pressure. One other common test is to draw some blood work to make sure there's no electrolyte disturbances, such as potassium that's too low, and also to check the blood for thyroid levels, because high thyroid levels can be associated with this. Interestingly, a large number of patients have what we call idiopathic atrial fibrillation or lone atrial fibrillation. It means the atrial fibrillation stands alone. There's nothing else wrong that we can tell is going on in the heart. The patient has a normal history, a normal physical, and every heart test that we have is normal, except for the patient does have atrial fibrillation once in a while.
If your doctor finds that you have high blood pressure or a thyroid condition, you will probably need to take medication to control these conditions. Your doctor will also work to restore your heart's normal rhythm. Blood thinners such as aspirin or warfarin may be prescribed to try and stop clots from forming in the upper chambers or atria of your heart.
People with atrial fibrillation are at an increased risk for a clot to get thrown from the heart and sometimes to other parts of the body, including the brain. This risk is higher than the normal population that does not have atrial fibrillation.
A stroke occurs because blood flow to part of the brain is blocked by a tiny clot.
They told me I had a mild stroke, which kind of affected my speech a little. I think that anybody who have afibrillation should take their medicine on time, go for their appointment when they are supposed to go for their appointment to prevent afibrillation and the complications that I went through.
We are developing treatments for stroke, including strokes due to atrial fibrillation, but to prevent these strokes is far better. And therefore, we really need to make sure people understand the importance of this irregular heartbeat as a cause of stroke.
I was under the impression that I could just kind of ignore it, being an athlete myself. But I came to the realization you cannot ignore atrial fibrillation, that it's a serious matter, and it can be a serious matter.
It's important to recognize that atrial fibrillation can increase the risk of stroke 6 to 10-fold if it's undetected. And yet, if you know about it and have it taken care of, why, you'll lead a normal life.
The most important thing to keep in mind that would alert you that a stroke is imminent or is at increased risk is if you have symptoms of a stroke. And those can be very short-lived, maybe only a few seconds to a minute or so. And so you can't ignore them even if they're very brief. And they usually consist of either numbness or weakness on one side of your body, a transient loss of speech, a transient loss of vision off to one side or in just one eye, and severe dizziness. Those are all warning symptoms, and if you have any of them, even for a minute or two, you need to go to your physician or to the emergency room.
If you recognize any of the symptoms of a stroke, seek medical help right away. And if you're on medication to treat any of the conditions that can cause a stroke, stick to your treatment and follow your doctor's advice. It's the best thing you can do for yourself.